Hello and welcome back to Nolan Financial Radio. My name is Kris McKinney from Nolan Financial Partners. If you'd like more information about what you hear during our show today, give us a call at 719-210-4242 or visit us online at nolanfinancialpartners.com. That number is 719-210-4242. And while at our website, click on that radio page, check out past shows, and subscribe to our program on Apple Podcasts or Spotify. Please don't hesitate to reach out to us with questions or set up a face-to-face or a virtual meeting. So for many of our clients, Medicare is an essential part of both the retirement and financial strategies. So despite this, it's important for so many Americans. I've always been a bit taken back by the number of people who can't really tell me much about Medicare beyond the fact that they may provide some degree of health care during their retirement and that they have to sign up for it when they're about 65. So accordingly, I thought we'd spend our time today talking about some of the things you should know about Medicare, both in general terms and specific to 2023, because there's been a lot of changes. But before we get into today's topic, let me introduce you to my co-host, Tony Shore, who I'm pleased to report will be buying me lunch very soon, thanks to a little recent wager we had.
Yeah, right. My brackets are gone for Final Four. I don't know much about college basketball anyway, but, we do brackets just for fun here at work. And with all the upsets, I'm done already. I'm out, so.
Yeah, well, I selected Arkansas to beat Kansas because I don't like Kansas very much. And Arkansas's got some talent.
Yeah.
And that's why I had a few more left in my bracket.
That's true. I did not have that, I will admit. So,
yeah, nobody did.
No, I know they didn't, except you.
Except me.
I noticed like on the leaderboard, I looked at it today for the office here where I work.
Mm-hmm.
And some of the folks I work with are in a bracket. And like the number one person, how did they know? I mean, they picked some of the upsets. It's like, that has to be just luck. I mean, that's crazy. So,
yeah, well, it goes to the seeding is not very good. And this year,
no, especially this year really shows that, because the seeding it's not even close.
Not even close.
Yeah.
I mean, we've got two number ones go down in the first two games.
Yep. Two number ones in the first two games. So that's a little tough. Well, speaking of tough, I laughed during your intro because you're talking about Medicare and how for a lot of people, even though it's going to be a huge part of their lives, they really, a lot of people don't know much about Medicare, and they just think they automatically start getting it when they're 65, and that'll cover their health care. And I used to be that way. I mean, I haven't been that way for a while, but I laugh because that was me. I'm if our listeners out there we're thinking that, don't feel bad. That's most people, I think.
Yeah, I think it is most people. We have so many clients that when they get to be about 64 and a half, we have a sit down talk with them, and they ask them about what they're planning to do. Usually they do not have a plan. I don't know, sign up for Medicare. And so we say, well, there's some people that can help with that. There's some professionals that will help you decide what kind of Medicare supplements you want to have. Do you want to have Part B? Do you want to have these other things, the drug supplement? Do you want to have an Advantage plan? And so these are things that have to be decided when you sign up for Medicare, and they can have big impacts to your financial future. And that's why we always want to talk about Medicare and give the most important information that we can give to our clients, and then get them to a professional that is kind of part of our team that will give them the best advice. There is no cost to get that advice. That person gets paid through a very small commission by whatever you decide to do. Sure. It doesn't take money out of your pocket whatsoever, because all that is baked into how those things are done. Whether you do it yourself or go get professional help, there's no cost to you.
Yeah. Yeah. And I would get professional help when it comes to Medicare. And I know that you and Tara help your clients with Medicare and have people you work with, Medicare specialists, because it is so important to get this right. And Medicare doesn't cover everything. You need to know what it's going to cover and how it's going to fit your specific situation. And so, what your neighbor's doing isn't exactly what might work for you. So again, Medicare is one of those things, like a lot of what we talk about. But I know that the show is about Medicare today, and that's what you want to talk about. But I think you kind of buried the lead here, Kris, which is your new glasses and how great you look in the new glasses. Your blue blocker lenses that you wear, and the frames, though, those turquoise frames, I'm going to say they took an instant 10 years off your look. You look 10 years younger.
But the reason for having the blue turquoise frames is because it'll make me remember that these are my blue blocker glasses. So when
that doesn't sound like something a young person would say. You need to remember which pair of glasses you're wearing. But no, they look good. They look good. I just had to bring that up on the show because I'm sure our viewers who view this show on YouTube, our radio listeners will just have to picture it or check out the Nolan Financial Radio show on YouTube. So online. Medicare is a topic that we can't wear out because it's so important. And again, Medicare open enrollment will come this fall. So we should talk about this. Where do you want to begin?
The first thing I wanted to talk about was deductibles. They are down this year. That is good news. The annual
rarity.
It is rare. The annual Part B deductible is now $226. It's a $7 drop from last year. So that's pretty interesting. This is the first Part B deductible drop in a decade. So for many yearly deductibles on Medicare Advantage plans and standalone Part D prescription drug plans, they're determined by the plan you choose, right? So where you live, those kind of things. However, the federal government does limit Part D deductibles to $505. So that means that you need to save up $505 for each coming year so that you can pay all those deductibles. Yep. That's how we do it when we start creating plans, is we say, okay, what are all your deductibles for everything that you do? Okay, let's set that money aside so you have it.
Right. Yeah, and what is it that Ben Franklin said? $7 saved is $7 earned, something like that.
Yeah, that's right. You don't earn any money if you don't save any money because it's gone.
Yeah, exactly. Thanks, Ben. We quote. I think people quote Ben Franklin a lot or attribute a lot of quotes to Ben, and sometimes I wonder, did he really say all those things, especially about finances and money?
Right. I mean,
I've heard like three different, like Einstein and Ben Franklin. I've heard it attributed to them that the quote, compounding interest is the eighth wonder of the world.
Oh,
and I've heard that attributed to Ben Franklin and to Albert Einstein. So
that's interesting. Well, Albert was alive when we had lots of interest-bearing accounts, but I'm not sure about
Ben Franklin. Why would he say that? I don't think there was a lot of compounding interest back then, was there?
No. There was life insurance, and there were pensions back then.
Yeah, sure, there were pensions,
mainly for military folk. But there were pensions.
And Social Security and a lot of the stock market wasn't even around back then. So
no, there was no exchange like
maybe
that.
It was Albert Einstein, huh?
Yeah, probably.
So when you're talking about these deductibles going down, that's good. I think people need Medicare. What else do you want to tell us?
So even though the Part B deductible went down, the Part A deductible went up. So as many of you likely know, many Medicare enrollees don't pay a monthly premium for their Medicare Part A,
right?
Which is like inpatient hospital care, skilled nursing facilities, hospice, and certain home health care services. A deductible is charged for every hospital stay. So this year, Part A deductible is $1,600 per stay. That's a jump of $44 from last year. So additionally, folks who haven't worked long enough to qualify for Part A without premiums are paying $506 a month this year. It's a small increase of $7 since last year, but it's something that you just have to count for, right?
Yeah.
So whether you must pay the entire Part A premium is determined by your spouse's work history.
Yeah.
Folks with Medicare Advantage plans need to review their plan for what their hospital charges might be.
Yeah. Yeah. And I mean, Medicare, I mean, in general terms, and with regard to these changes this year, I think it's a good topic to discuss with your financial services professional. Don't try to navigate this alone. I know that you can help explain how a Medicare strategy could fit into someone's overall broader financial strategy, correct?
That is exactly correct, and we fit every type of issue that could come up into the financial plan that we create, so that you have those backup funds to pay for things that may have to come out of pocket, and so we always want you to get as much of what you're going to need taken care of through the Medicare and the different supplements or advantage plans, so that you don't have huge out-of-pocket expenses. And so we plan for that.
Yeah. Yeah. So what's next? What else do you have for us?
So the Inflation Reduction Act of 2022 is kind of the biggest player in a lot of things we're going to talk about today. There's a laundry list of provisions intended to reduce the cost of prescription drugs. So this is huge for Medicare beneficiaries. Copays for a 30-day supply of insulin that's covered by Medicare drug plan is now capped at $35. That means enrollees don't have to pay more than $35, even if they haven't reached their annual Part D deductible. So not every plan covers every type of insulin. So you got to make sure that when you get your coverages, it covers what you need it to cover. I've heard that the state of California is looking at creating their own insulin lab to create their own insulin and start selling it to giving it out for $30 to all the people that are inside California that need insulin and are part of the statewide coverages that they have.
Yeah. Yeah. I don't think it should be limited to just Medicare, but even Medicare doing this, capping the cost of insulin, that may be life-saving and life-changing for a lot of people out there, Kris.
Right. Yes, it is.
I mean, that's huge.
Well, and it'll keep people from trying to skip insulin doses to stretch it out.
I heard about, the 21-year-old kid who, I don't think his parents were alive anymore. He passed away and it was all because he couldn't afford insulin. And I read that news story. That's been about a year that I heard that story, but there's stories like that all the time. People are dying because they can't afford insulin, at least at one point in time. Now there's even a company that said, we're not going to charge over $35 for a month's supply of insulin to anybody. Right. One drug company, not one of the big two, but I think one of the big three or four, like a third or fourth tier company, said all of our insulin is going to be, we're going to cap it ourselves, which is great. That's a humanitarian gesture. And people think, well, these companies have a right to make a profit, but these were crazy prices. Remember when the EpiPens for insulin were like
$600?
Yeah, $600. And that's why when that happened, that's why people started dying. I mean, it's nuts. So I think that's great. And I'm not too worried about the bottom lines of Pfizer. I looked it up. They're doing just fine. They're doing just fine. Yeah, they have billions of dollars in net profits after expenses, billions and billions of net profit after they pay their staff, after research and development. So, yeah.
So consider this: if you were a franchisor and your job was to sell for the companies that create these medicines, how many places in town would you think they'd want to have? And all you have to do is drive around town and look at every corner has an urgent care or some kind of
There's
clinic
so many
on it.
clinics
It's
and urgent cares and emergency
crazy.
rooms and
Yeah.
hospitals.
And
They're
so,
everywhere.
yeah, so that they have no problem selling what they're making.
Yeah, no, there's a market. There's a market, and I don't expect them to take a loss on all their medicines either. We need them. We need these
No,
companies to be able to do the research and development. I mean, so there is a line in there, but it's nowhere close. And
but
when
stuff
it,
for like insulin, I mean, the research has been paid off for how many years?
yeah, it's ridiculous. Yeah, that's long since been paid for. So
Yeah.
yeah, I'm glad they've capped it for Medicare. I wish they could do that for more medicines, and it sounds like they are going to do that, right?
That's right. They're going to start to be able to get a rebate from drug manufacturers if they increase the cost of drugs at a rate that's higher than general inflation. Medicare is
Good.
going to be able to penalize companies that jack up prices just because they can. They feel like there's a need, and they're maybe only one of 2 or 3 providers of it, and so they do it. So they're going to be penalized if they do that now. So we've got some controls that Medicare can put
That's
toward
good.
those things. So that's a really great thing.
That's good for our seniors out there, and I think it's
Yeah.
really important. Hey, before we go on, Kris,
Yeah.
why don't you let our listeners know how they can get a hold of you and Tara if they want to talk about healthcare and making that a part of their financial plan, especially if they're in or approaching retirement. If you're over 50, this is really critical, but I think you need a financial plan in place anyway, and there's no cost or obligation for that initial consultation. How can they do that?
Well, they can do that by calling 719-210-4242. Mention the radio show, and we'll set up that complimentary consultation. Again, that number is 719-210-4242. Go out to our website, check us out. You can also contact us through there. You can find the phone number there if you're driving right now. Just remember nolanfinancialpartners.com, and then you can reach us when you get out of your vehicle there at home.
Sure. Sounds great. I appreciate that, Kris. And let's keep it rolling. So obviously it's good, this rebate that manufacturers have to provide a rebate if they raise the price of drugs more than inflation,
Yeah.
which over the past few years, that's happened every year. I mean, we've seen drugs raise 50% in 1 year when inflation at the time was like 3 or 4. And of course, even with inflation at 9% or 6, like it is now, we've seen drug prices raised a lot more than that. So I think that's a really good one in it. And I think it tells us why Congress took the steps it did to help out Medicare and help out our seniors.
That's right. And I think it's a really important thing that we take care of our people that need the most help with their medical situation, and that is our seniors, right?
Sure.
So one things that this Reduction Act 2022 is going to allow Medicare to start negotiating prices with manufacturers. On September 1st, they're going to reveal the first 10 Part D drugs that they're going to be able to negotiate prices with.
Wow.
And then it's going to come from a pool of 50 medications that Medicare already has part of their drug plans. It's the ones that they spend the most on, and that will go into effect in 2026. So that way the drug companies can prepare for those
Sure.
new prices. So they will not be hurt financially. But it's really great that we're going to be able to start to negotiate for a lot of these high use medications that Medicare is buying so much of. Why can't they negotiate? Well, they should be able to.
I don't understand why they weren't allowed to negotiate prices with the drug companies anyway. We're the only country in the world where they don't, like Canada and Europe. I mean, why would we not be able to negotiate better drug prices when it's, hey, this many people on Medicare are going to be buying this drug. We want to be able to offer it through Medicare for this price and make a deal with the drug company to get a better price for Medicare recipients. I don't know why they limit it to start with 10 drugs. I don't know why they're waiting till 2026. I don't know why they can't just negotiate prices for all drugs and why it hasn't always been that way. Those are my questions.
It doesn't seem very capitalist, does it?
No, it doesn't. It's like private companies can be capitalistic, but our own government isn't run that way. And sometimes that's for a good reason. But when it comes to negotiating prices for the government, this is why we hear about the military paying, you hear those stories. You used to hear them back in the day, especially in the 80s.
$300 for a hammer.
The $300 hammer, or the toilet seat for, I forget how much the toilet seat was. It was great. Like $200 toilet seat.
Yeah, it was very expensive.
So it's like,
they've
you
changed,
can buy that.
They've changed that.
Changed. Yeah, they have.
They fixed that.
But that was happening. There was some budgetary expenses our government was doing. And I think, there's a lot of areas that our government, like military contractors, they probably don't do a good job of negotiating better prices. It's kind of like greasing the palms.
Well, sometimes what they need is a one-off. So
that's tough. Yeah.
That's
then
tough.
You got to pay top dollar. Yeah.
So they do that. So I've seen that. And then for some things, like to get some things, they have to buy them in bulk, and they don't want them in bulk. They want them in onesie twosies. And
that's tough.
Things like that happen. And
but you don't think they're overpaying at all for things like tanks and planes?
Well, tanks and planes, because they're all one-offs.
Yeah, that's true. That's probably true. But I will tell you what's not a one-off are the vehicles that our troops were riding around in Iraq and Afghanistan in, like the Humvees, and those things are like, I know our Mitch, our editor, has told me stories, and I've heard stories from other people who were over there. My brother-in-law was in Afghanistan for a while, and it's just like, you know why they're wearing helmets in there? It's not because they're worried about getting blown up. It's because that's just a death trap in there. You hit one little bump, and it's all metal, and it's all square, sharp corners, and and those things break down all the time, and
But I think they put diesel engines in them, and you can't get parts. And
as big as our military budget is, our troops should have the best of the best of the best. And I know it's not supposed to be comfortable, but at the same time, people are getting concussions inside these vehicles because they're so poorly designed.
Maybe some shocks instead of just bare springs, or, I don't know.
We got off topic. Government spending. We could spend all day on government spending.
That's a seat with some foam in it. So so Medicare.
How about that Medicare? Well, I'm glad they can negotiate. So anything else? What should we move on to? I mean, it's been a great show so far. So what else do you have to say?
One of the key things I want to make sure that I get in here, if you don't go seek help like we think you should, is you need to know that, and generally within 3 months of your 65th birthday, your coverage is going to be there. So you need to go talk to the Medicare folks about 3 months before your 65th birthday. I'd say, and I would talk to that professional before then. So about 4 to 6 months out from your 65th birthday, kind of lock in what your decisions are going to be for that coverage. Now, you got to remember the Affordable Care Act said that no matter what your condition is, Medicare will take care of you. But you've got to get that Medicare started, and you've got to get all your supplements and plans in while the window is open during those enrollment periods.
Sure.
So you got to know what those are and get those going. And even if you're still covered, buy your employer's health plan, you still need to go sign up for Part A for your 65th birthday. A lot of people don't know that when they're planning to work till 70, but they need to get that done.
Yeah. Oh, that's a good point. I didn't realize that. So you do need to sign up even if you're continuing to work, because me, I'm going to work well past 65 as long as my voice holds out. Right. So, right.
You don't have to decide on all your supplements and things like that at that point, but you got to sign up for Part A. You're not covered under it yet, but they want you to sign up.
Right. Like, right. So you got to sign up at 65 regardless. But then when you do stop working, let's say you are going to retire at 65, you stop working.
Yes.
You're no longer getting coverage through your work. You've signed up for Part A. You also want to talk to a financial services professional like yourself and Tara to talk about Medicare supplements, because Medicare does not cover everything, right? It doesn't cover hearing, vision, or dental, right? Am I right?
That's right. No vision. If you are there's some new things in the law. If you're having a procedure that affects that you need some dental care for, then that dental care will be taken care of. But it has to be in association with, some kind of fixing your jaw or some kind of cancer treatment where you have to you need to get a cleaning or something like that. So there are some ways where dental will be covered, but in general, no. You need to figure out how you're going to get your dental and your vision taken care of while you're retired.
And your hearing, right? I mean, hearing aids aren't covered by Medicare.
Oh, yeah.
And long-term care is another one, right? Medicare doesn't cover long-term care.
So long-term care is a whole nother subject, but yes, Medicare does not do it. Medicaid does, but you have to become pre-destitute to get onto Medicaid.
You have to spend down everything you have for the most part, right?
Pretty much spend everything down. And the problem is usually not for the person that's going on to Medicaid, because they're taken care of inside Medicaid. It's the spouse that is left at home,
and the family,
and the family,
the children
that is having to either cover the extra costs that you have to bear,
or if they were planning on inheriting the family business or family farm, that could go to cover long-term care, and you're not going to get an inheritance, right? So that's important. We'll talk. That's a whole other show, but it's been a great show. We've covered a lot. We're out of time. Give that phone number one more time that our listeners can call, Kris.
So please call 719-210-4242. We'll set up an appointment for you that will be complimentary if you mention the radio show. So that's how you get in. Call 719-210-4242. Go out to our website, nolanfinancialpartners.com. You can learn more about what we do. You can also check out some of our past radio shows and figure out how to get on the podcast for your Apple or Android phone. Figure all that out. So give us a call, 719-210-4242.
All right. And that does it for today's episode of Nolan Financial Radio with our host, Kris Nolan.
Join us again next week for another episode of Nolan Financial Radio.
Good show, Kris.